Welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and let's look into today's reports. Novel 1% glucose isotonic electrolyte solution improves the kid's safety during intraoperative period. Fluid therapy is a fundamental approach for safe intraoperative anesthesia management in children. Inappropriate fluid management can often result in several serious complications, including brain damage and even mortality. A new study has proven that a novel 1% glucose isotonic electrolyte solution is beneficial as an intraoperative fluid therapy in children. This regimen helped to maintain glucose as well as electrolyte concentrations as well as the acid-base stability. Rare case of primary breast cancer metastasizing to GI tract has been detected. Breast cancer, being the most common cancer, is a global health problem that needs management. Researchers have recently found a rarest metastatic lobular mammary carcinoma in a 52-year-old Bahraini woman who presented with an obstructing renal mass which turned out to be gastrointestinal tract metastasis from primary breast cancer. It was concluded that GI tract metastasis from primary breast cancer is rare and not easily diagnosable. It should be suspected in a patient with a history of lobular breast carcinoma with new onset of GI tract symptoms. Inflammatory skin diseases associated with the risk of chronic kidney disease. As per a new study published in the British Journal of Dermatology, atopic eczema, psoriasis, and hidradenitis suppurativa are significantly tied with stages 3 to 5 of chronic kidney disease. Hence, it is important for patients and physicians to recognize the manifestations of such skin diseases in renal disease to minimize and even prevent much of the morbidity associated with these conditions. PET MRI helpful in difficult cases of epilepsy. A recent study reveals that hybrid PET CT as well as an MRI can help in identifying brain lesions causing seizures in patients with drug-resistant epilepsy in cases of failure of standard approaches. The study highlighted that an hybrid PET MRI may improve the detection of epilogenetic lesions, allowing to optimize the pre-surgical workup and also to increase the proportion of successful surgery even in the more complex cases. Housework linked to sharper memory and attention span among elderly. Regular physical activity is always considered good for maintaining optimal physical as well as mental health, and among the older adult, it curbs the risk of long-term conditions, falls, immobility, dependency, and even death. A research published in the BMJ journal has reported that housework is linked to sharper memory, attention span, and better length strength, and by extension, greater protection against falls, especially in older adults. These results collectively suggest that higher cognitive, physical, and sensory motor functions related to heavy housework activities might plausibly be associated with lower physiological fall risk among community-dwelling older adults. That's all for today. I shall see you tomorrow.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.